Hello, my name is Zoltan Arany. I'm a professor of cardiology at the University of Pennsylvania in Philadelphia, Pennsylvania. And I'm here to very briefly talk about genetics in peripartum cardiomyopathy. So, is there a genetic predisposition to peripartum cardiomyopathy? The answer is yes, but not always. We have looked at about 600 or more women with peripartum cardiomyopathy and their DNA, and we find that in about 15% of cases, there are mutations in some genes. In genes that have funny sounding names like Titin or TTN or DSP. The names don't really matter to you. Now, the important thing is that we haven't looked at all the genes. We've only looked at about 500 of them, and there are about 20,000 total genes. So for all we know, there may be more mutations in other genes. This kind of study takes time and money. So stay tuned and we'll keep you posted as we discover more things. Now here are the common questions that we hear and when we talk about genetics of peripartum cardiomyopathy. One question is, does having a mutation in one of these genes change the way you should be treated or your chances of recovery? The answer rarely is yes. Usually the answer is no. In the common mutations, there seems not to be. But there's a couple of rare mutations that are associated with more risk for rhythm problems, like the heart suddenly stopping, for instance. So if you have one of these mutations, your cardiologist might recommend specific approaches to your treatment. But remember, 99 out of 100 of women with peripartum cardiomyopathy will not have one of these mutations. This is very rare. So the next question, also sort of obvious, is should you get genetic testing done? Should a woman who has peripartum cardiomyopathy have genetic testing done? My own personal recommendation in most cases is yes, for two reasons. First, you might have one of those really rare mutations that would warrant a slightly different approach to treatment. But even if you don't, but you find that you have one of the more common mutations, it may be useful to know this. It may be useful especially for other members of your family to see if they also have it. For example, a sister who is thinking about becoming pregnant would want to know if she has this mutation or not. The most important thing to remember about genetic testing, though, is that it's a complicated and a very personal decision, and you should seek advice from genetic counselors. Genetic testing is not right for everybody. So the bottom line, in many ways, is that we still have a lot to learn. We hope that setting up this registry will help us learn a lot more, and we will keep you posted on everything that we learn.